Hey everyone, I am the nurse doc tutor, and today's lesson will be on how to think like a nurse. So I know you nursing students have heard your instructor say you need to think like a nurse, and you're just like, how can I think like a nurse and I am not a nurse? So if you are struggling with critical thinking, guess what? This video will change your life. Let's start. Alright, so we're going to start here with the most important thing, and also the first step in the nursing process is assessment. So you need to sharpen your assessment skills. So remember that two types of data we have objective data and subjective data. So we have our subjective data, and that is what the patient says. And then we have our objective data, which is measurable. So whether it's vital signs, your physical assessment from your head to toe, or lab values, interpretation, all that'll be your objective data. So it is so important to always pay attention to subjective data, because a lot of times patients' lab values and patients' vital signs and even the head to toe assessment, all that stuff will be normal, but it is what the subjective things that the patient says, like, I just don't feel good, I just have this hunch, like something's just not right. Those things are just as important. So I want to challenge you all to get a baseline assessment done as soon as possible. So if your shift starts at 7 o'clock, you want to at least assess your patient by 7:30, whether you've just done a quick focus assessment or even if you took the time to do a full head to toe assessment. It is so important to get a baseline assessment on your patient early on. Why? Because if something goes down, we have something to compare it to. So sharpen your assessment skills. So we're going to talk about on the next slide how that is, how we actually do that and what are we actually looking for when we're looking at assessment data. All right, so interpretation of assessment data. So these are not all the things, but in my 9 years of being a nurse, these are some things that I learned. So if you have a patient who has mental status changes, that could be either blood sugar issues, that could be a stroke, or a patient just having lack of oxygenation. So that's why it is so important to get a baseline assessment done as soon as possible, because like I say, if something goes down, we have something to compare it to. If your patient now is dealing with irritability when they weren't all before, that can show a lack of oxygenation and infection as well, especially like in the elderly. If you see that the patient's limb is cold or pale, that's an indication of possible lack of blood flow. If a patient has decreased blood pressure and increased heart rate, that could mean they're in a hypovolemic shock, or that patient has some internal bleeding going on. Yellow or green drainage, infection. Bright red blood, that is a new bleed. And if something is hot to touch, and if you smell a foul odor, that is infection. So these are just the little takeaways that I've gathered throughout my nursing career. So this is not the all be all, but it is so important to get a baseline assessment done as soon as possible. So you're like, Nurse Doc, I don't even have patients on my own. Well, in nursing school, it is so important to pay attention during your health assessment class when the instructor is going over all of the normal ways. So how normal skin turgor is, right? How normal pulse to feel. So when you feel or when you hear something abnormal, then you're able to do something. So it is so important that you just remember what's supposed to be normal. So how is the skin supposed to look? How is the heart supposed to sound? What are breath sounds supposed to sound like? And then if we hear or see something different, then that could alert us that something is going on. All right, so another important thing is setting priorities. So in nursing school, you will have these questions about, hey, which patient should I see first? And then in real life, once you become a nurse and you have like 5 or 6 patients, then you need to plan your day of which patient should I see first. So first, what you're going to always focus on, first priorities is ABC. So airway, breathing, and circulation. So if the patient has any airway problem, if the patient is having any breathing problem, we are for sure going to go to them first. And then circulation. If that patient is having any circulation problems or any cardiac problems, then you want to go see that patient. If that patient is having sudden vital sign changes, super high vital signs, super low vital sign changes, then you want to go see that patient as well. Also, lab interpretation. If a patient has a super high potassium, then you know you need to go see that patient. If that patient has a super high calcium, you know you need to go see that patient. Or if a super low potassium, things like that. So it's important that you know your lab values, and that you also know your normal ranges for your vital signs, to say that, okay, if I'm presented with a patient and their lab value is this, I know that this is a priority. All right, so another priority is changes in mental status, untreated medical problems, pain, urinary elimination problems, all those things. The biggest thing I want you to understand is that after you dealt with airway, breathing, and circulation issues and vital signs and lab values, we then can move on to Maslow's hierarchy of needs. So I have that on the screen. So as you can see, you want to then start with the bottom row. So where there's your psychological, food, water, and those type of things, and then you move up to safety and all those things. So you would just go up the ladder. So a lot of times students, they always go for airway. They're going to pick airway no matter what. But that is true if the question is stating that the patient is having current airway problems. The question may just say the patient has a history of COPD. If they just have a history and they're not currently in an exacerbation, then that patient may not be a priority. So I want you guys to remember ABCs: airway, breathing, circulation. And then if we don't have any of those issues going on, we're then going to move to Maslow's hierarchy of needs. It is so also important that we pay attention to mental statuses changes in a patient, behavioral changes in a patient. It is so level of consciousness in a patient. It's important that we pay attention to that. So that's why it's so important to early assess our patient. So we asked our patient their name and date of birth and where they were. At 9 o'clock, they were able to answer all those questions. Now, when we came and do our 1 o'clock meds, we noticed, we asked them their name and date of birth and where they were at, and they now couldn't answer these questions when at 9 o'clock they could. So what has happened during that time, especially if that patient has no history of dementia or history of Alzheimer's? So it is so important that we pay attention also to subtle changes. One thing I always teach my students when it comes to vital signs is trend vital signs. So you then want to start to look at, the average of the patient's, blood pressure. So if you check it and it's 130/80, I want to see what was it the time before that. I even want to go back maybe to the day before and see what was it. And just to keep a little file of it. And then when I check it again, I see that, it's 140/80. So I see that their blood pressure is trending up. So it is so important to try to analyze your vital signs and lab values, and always pay attention to the subtle changes. The subtle changes. That's what separates nursing from any other profession, that we notice those subtle changes, right? And if we could notice those subtle changes and we could then develop a plan of care around those subtle changes, we then could prevent something big from happening. All right, so how to decide which patient you will see first. So this is what I want you guys to remember. So in the other slide, I just told you ABCD Maslow's hierarchy. But this is how you need to read your question. If I don't go see this patient now, this patient will suffer the most harm. If I don't go see this patient now, meaning first, they will suffer the most harm. Or on the flip side, you can say this: if I don't do this intervention first, the patient will suffer the most harm. This is how you answer priority questions. I just cracked the code for y'all. I just made you aware of how to get every one of these questions correct. This is how you do it. All right, so let's jump into some examples. So the first question is, after your change of shift, you are assigned to care for the following patients. Which patient should you assess first? Which patient should you go see first? So A, we have a 60-year-old patient on the ventilator for whom a sterile sputum sample must be sent to the lab. B, a 55-year-old with COPD and a pulse ox reading on the previous shift of 90%. We then have a 70-year-old with pneumonia who needs to be started on IV antibiotics. And then we have a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator. So I'm going to give you some time to answer. Which patient, if we don't go see first, will have the most harm? All right. So I started off easy. So we're going to see the patient D. We're going to see the patient with a current issue. So this patient is currently complaining of shortness of breath after using a bronchodilator. So we know bronchodilators should open up the airway, right? So they should be have some relief from shortness of breath. But being that they are complaining of shortness of breath and they have a current airway issue, we're going to go see them first. All right? Does it make sense why we didn't go see the 55-year-old with COPD and a pulse ox reading of 90 on the previous shift? Well, that's talking about on the previous shift. We need an actual current assessment of what their pulse ox reading is on your shift. But also, remember, our patients with COPD, their O2 saturations can hang around 88 to 89% and they actually be fine. So, shameless plug, go watch the COPD video if you have any issues about understanding COPD. And also, I do have a video on asthma as well. All right, next question. The nurse is assessing multiple patients. Which patient should she go see first? So we have a 33-year-old with a fractured femur who reports unrelieved pain despite medication. We then have a 48-year-old with a chest tube who has had 50 ml drainage in the last hour. We then have a 59-year-old with AFib and a heart rate of 140. All right. And then we have a 29-year-old with a severe migraine requesting antiemetic medication. So who are we going to go see first? This one is a good one. So I'm going to go see that patient who is in AFib. So remember, when patients are in AFib, I always say they're going to fire. All that firing going on, all that quivering going on, right? So a patient has a rapid heart rate and they are at risk for decreased cardiac output and possible hemodynamic instability. So this patient puts this patient at an increased risk. So being that this patient's heart rate is super high, obviously this patient is in uncontrolled AFib, being that their heart rate is that high. So we want to go see this patient first. Does that make sense, you guys? All right, so it says, next example is, after receiving shift report, which patient should the nurse see first? A 30-year-old with sickle cell anemia reporting 8 out of 10 pain in their back and joints who was last medicated 2 hours ago. We have a 48-year-old with a suspected pulmonary embolism who is receiving heparin and now has blood in their urine. A 55-year-old diabetic patient with a blood glucose of 250 and has a foot ulcer with purulent drainage. Or would we go see a 60-year-old one-day post-op after abdominal surgery with absent bowel sounds and a distended abdomen? I'm going to give you some time. All right, so if you said we were going to see the patient with the pulmonary embolism who is receiving heparin and now who has blood in their urine, we're going to go see that patient. So we know that heparin can cause bleeding, right? So maybe that patient needs their heparin, that heparin drip needs to be adjusted. Maybe they're getting too much heparin and it's thinning their blood too much, and that can put the patient at a risk for bleeding out. So we want to make sure we go see that patient ASAP and then stop that heparin and call the doctor. All right. So why would we go see the patient with abdominal surgery with absent bowel sounds? Because I know y'all like, my teacher told me if that patient don't have bowel sounds, that is important and we need to call the doctor ASAP. Well, we do. But in this case, that patient just had abdominal surgery a day ago, and sometimes it takes the bowel a few days to wake back up. So that is expected in that patient. With sickle cell, they may still be dealing with pain. They were medicated 2 hours ago. That's important, but just not priority. And then a diabetic with their blood sugar 250 is 250 high, yes, and who has a foot ulcer with purulent drainage, that's important as well, but that's not priority. Priority is that patient who is now bleeding in their urine. All right, so the next question is, after receiving the shift report, which patient should the nurse assess first? We have a 40-year-old with newly diagnosed type 1 diabetes who has a blood sugar of 350 and is complaining of thirst. We have a 75-year-old with Alzheimer's who is wandering the halls and appears agitated. We then have a 60-year-old with heart failure who has JVD and 3+ pitting edema in their lower extremity. And then we have a 50-year-old 2 hours after post-thyroidectomy who is experiencing tingling around the mouth and in the fingers. Who are we gonna see first? This is a good one. So, if you said we're gonna go see the patient who is 2 hours after getting their thyroid removed, that is correct. So, tingling around the mouth and in the fingers could indicate hypocalcemia, which is low calcium, which is a complication after thyroid surgery due to accidental removal or damage to the parathyroid gland. This can lead to tetany or even life-threatening laryngeal spasms if not treated promptly. So you see how this one was more complicated? We would have to know what are some things that we need to look for after a patient has had thyroid surgery. All right, so why wouldn't we go see the diabetic patient first? Because thirst is a sign and symptom of their blood sugar being so high. The patient with Alzheimer's disease, well, they have Alzheimer's, so they may wander around. So that's not priority. Now, the one that could have been close to choosing is the patient with heart failure who has JVD and 3+ pitting edema. But if you know the pathophysiology and you know the signs and symptoms of heart failure, we know that this stuff is expected in these patients. All right, how's everybody feeling about these? I think you guys are doing so good. All right, last one. All right, so the nurse receives a shift report on 4 patients. Which patient should the nurse see first? So we have a 28-year-old with a femur fracture reporting severe pain unrelieved by morphine that was given 30 minutes ago. We then have a 56-year-old with unstable angina, which is scheduled for a cardiac cath in 1 hour and reports feeling anxious and nauseated. We then have a 63-year-old with a history of COPD who has a new onset of confusion, respiratory rate of 24 breaths per minute. And then we have a 72-year-old with sepsis and a blood pressure of 82/58 who is receiving their first round of antibiotics. All right, so who are we going to see first? All right, so this one should be a giveaway. So the answer is going to be the 63-year-old with a history of COPD, but they now have a new onset of confusion and a respiratory rate of 24 breaths per minute. So you remember in the previous slide when I talked about changes in mental status, I said one of the reasons behind a change in mental status could be the lack of oxygenation, and this could very much be what that patient has going on. So anytime you see a new onset of something, especially if it's a new onset of a respiratory issue or a new onset of a mental status change or even a new onset of pain, this could be something that we really need to pay attention to. So you guys, I think you guys did an amazing job. So all you want to do is just keep practicing these over and over again. And then as you can see, what we also did, we practiced going over the other options, and we actually talked out like, hey, why wouldn't I go see this patient first? So all of that, I hope this video really made sense for you. And one of the biggest things is to continue to do NCLEX questions. Continue to practice priority questions. Always just continue to practice. You get better by just practicing. And another thing to remember is that the biggest takeaway is to sharpen your assessment skills. You have to sharpen your assessment skills. I believe in you guys. I know you guys can do it. I will see you in the next video.